Hi, I'm Dr. Matt Sheehan, and I'm back right now to show you how to do my 3 favorite neck stretches, the most important ones I use in my practice with my patients every day at Medford Family Chiropractic Center in Medford, Oregon. So the first one, this one is called a scalene stretch, named for the scalene muscles in the front of the neck. And the scalene muscles basically go from roughly from here down and through here like this. And the significance of the scalene muscles is that most of the time we see them causing trouble in people's lives and in people's necks when they've been in a whiplash situation, mostly in car accidents and things, falls off horses or whatever. And when the head gets whipped back or gets whipped sideways, these muscles will get stretched and or torn. And then they'll go into a state of spasm. And when they do that, what they do is they take a normal curve in the neck, which is in this direction here, like this, and when they spasm on both sides, they will often straighten out the neck curve, making it completely abnormal. And the neck will not function properly when that curve is lessened or removed. So what we want to do is release this spasm and this tightness in the muscle on both sides so that the neck, often gradually over time, will return to a normal curve, or as much of it as we can. And depending on how long these muscles have been in a state of spasm, it can take quite some time, or sometimes it can be relatively easy. So often these muscles will be released in a session either by me or by a massage therapist by direct pressure, right, like trigger point therapy or other forms of therapy directly on the muscles. And then the looseness will be facilitated by you stretching them at home. Okay, so how we stretch that muscle is pretty simple. You take one hand and you bring it over to the opposite side of your body. And how I tell my patients is to rest the pinky right on the top of the collarbone, right to the side of the windpipe. Okay, so the pinky goes right on top of the collarbone, and then where these fingers rest will be pretty much where you want them to be, in the lower part of the neck and the front. So what you're going to do, the purpose of this hand is just to push in and pull down in order to anchor the lower end of these muscles. Then what you're going to do is you're just going to turn your head slightly to the same side as the hand, and then tip your head diagonally backwards and away. So what we're doing here is we're effectively lengthening, we're stretching this front side of the neck. Okay, so you're going to tip it back, and you got to push in, fairly firmly here to really anchor that lower end of the muscle, and then tilt back till you feel a significant stretch right in the front, and then hold it there for anywhere from 30 seconds to a minute, keeping in mind that depending on what your clinical situation is, you may be experiencing an increase in pain elsewhere in the neck, depending on what's going on, right? It may be that for you, in your case, to tip your head back is not such a good idea. Listen to your body, listen to your physician, or your massage therapist, whoever you're dealing with, and don't cause yourself undue pain in another area just to do this stretch, all right? Or you can do it just until that starts to bother you and then quit. So there are 3 scalene muscles. So in order to stretch the other ones in the middle and the back, what we have you do is just slide your hand a little further to the back, kind of in the middle of the neck, about the same level height-wise, and do the same thing. Push in, pull down, and then tilt your head more straight sideways. And you'll feel a stretch all the way through there. Both these muscles, all 3 of these muscles are incredibly important and have their own pain pattern that I'm not going to get into now, but they cause pain in the arm and between the shoulder blades, essentially, and the shoulder. So that's a stretch there. Hold that for 30 seconds or a minute if you can. Good. So that's the first of 3 stretches for the neck. The second sheet I use that some of you will have, that you may want a little more explanation on, is this one here, which shows a stretch, another stretch for the middle of the neck, and a stretch for the back of the neck. And so, typically what I have somebody do when they are trying to stretch the side of the neck is they'll tip their head forward a little bit, and they'll take this, if you're sitting down, you'll take this opposite hand and tuck it under your pelvis and pull down on the shoulder, actively down, which essentially will be putting a pre-stretch on the muscle. And then what you do is you tip your head forward, and then you go sideways as far as you comfortably can until you start to feel a gentle stretch in the side of the neck. Now, if you are dealing with a whiplash and it's early on in your therapy, if you feel a significant stretch just with you actively tilting your head away, great, stop there. Allow that stretch to stay there for 30 seconds to a minute. If you're not feeling much of a stretch by actively tilting the head, you can bring the hand into play, bringing it over the top of the head and pulling, then not actively pulling with the hand, but just gradually allow the weight of the arm to hang on the head and pay attention. And just when you feel a moderate stretch but no worse pain, stay there for 30 seconds to a minute and then slowly come out of it. So that's for the side of the neck. And the other one that is more for the back of the neck, what you do is you tilt your head forward, turn your head about halfway. And if you're dealing with a whiplash, that may be all the way. You can move. So about 45 degrees, okay, like that. And then what you're going to do is you're going to tilt your head forward in the direction you're looking. So you're not going to go further sideways. You're going to go in the direction you're looking. So see, I'm tipping my head down. And I forgot to mention, we're also going to be doing that maneuver where we're pulling this opposite shoulder actively down again. So if you're sitting, hook it under your pelvis, pull down to pre-stretch all these muscles, the top of the shoulder and some of these posterior muscles in the neck. Pull down, so you tip your head forward, turn halfway, tip the head forward till you feel a stretch there. Hold it there for 30 seconds to a minute. If you don't feel much of a stretch with actively tilting your head forward, take your hand, bring it over the top of your head like this. And remember, with this one, you're not pulling sideways more, you're pulling in the same direction you're looking. So this elbow is going to be in front of my face. I'm pulling in the same direction just like that. So that's important. This is where people get confused with this stretch. So get this point down. You're pulling in the same direction you're looking. And where you feel it will give you an indication of where you're stretching it. So if you feel in the back of the neck, you're doing it correctly. And just hold it there for 30 seconds to a minute. Again, if you start to feel worse pain, if it's just a little, that's okay, it's just stretching the muscle. If you feel any more than just a little, back it off. And as a rule with all these, no bouncing. That's not good. You don't want to do this kind of thing, and no jerking. Okay, those are the 3 neck stretches I use. Thanks.